Alright, so we have the last step of our 3-step approach. We went over prevention, the first P. We went over optimal loading, the O, and now we're going to the second P, which is pain management. And now that you guys know what to do to address the main reasons of why you might have thumb pain as a Falcon player, again, they're playing for too long, weakness, mobility, posture, among everything else that we described. And these are some methods you guys can utilize to temporarily reduce pain. And there are things like icing, heat, medication, bracing, kinesio tape, Graston, and I go over these in detail in an article again that I'll link in the description. But let's go over them briefly. Icing, or what we call cryotherapy, right over here, is pretty simple. For the wrist, I either use TheraPearl or cold packs that you can find on Amazon, and both work great. But what's cool about this TheraPearl pack is that you can also use it as a hot pack for pain management. So it's best to wrap the painful area for about 15 to 20 minutes at a time. Don't cool it for any longer than that. And it's generally used during the initial stages of the injury, and it can be a really helpful tool for pain if things flare up. Next up, we have things like massage, and whether it be the use of a Graston, something like that, or instrument assisted soft tissue, or your own elbows and hands, you can massage to not only relax the muscles that are often stiff or overactive, but it can also address adhesions or stickiness that occurs between some of the layers of the tissues as a result of the healing process or improper healing. So I include some of these self-massage techniques within the walkthrough I mentioned earlier, so check that out. And then 3, bracing, right? We have a lot of support in the research, especially in tendon rehab, for the use of bracing, although it's really commonly overused due to the poor instructions for it. As I mentioned earlier, it's important for our tendons to move for health and proper recovery, and the purpose of bracing is to make sure that we prevent movement. So how does that really make sense? Well, in situations in which the tendons are very, very sensitive to movement, usually in those early stages or acute stages, or during a flare-up, it can help protect it from extra stress. But it can also prevent your thumb from moving into excess ranges of motion. So my recommendation really is to use it mostly within the first 3 to 5 days of a flare-up during your activity, and then you can kind of progress it to only using it at night, or when you're only playing, or when you're not playing, or when you're at rest. And you can slowly taper this usage because we want to improve our tendons' tolerance to stress by doing exercises. And remember, always think back to that picture of the temperature or the overheating meter, so that you guys can find that optimal zone and slowly build that up with everything that I described. And I will definitely create a little more in-depth video about bracing soon, so definitely look out for that. Next up, we have heat. Again, reference the article that I've written for more sort of detailed instructions, but you can use the same TheraPearls or a hot towel to heat up the area to relax your muscles, but also reduce some sensitivity. It's typically used before gameplay to warm up the muscles, and you have to be sometimes a little careful with it because it can promote some inflammatory processes. And just like icing, I would put it on for about 10 to 15 minutes before you start playing, and that's why some of the pros that you see use these hand warmers, because they warm up your muscles and allow for better nerve conductivity and better coordination as a result. 5th, we have medications, and medications such as Motrin or Advil can be useful to temporarily reduce pain, but I would absolutely consult your PCP, your primary care physician, or your pharmacist before you proceed to take any medication, because I'm just a doctor of physical therapy, not a medical doctor, not an MD. Lastly, we have kinesio taping, and I will definitely be releasing some self-taping applications to go along with the walkthrough to help you guys reduce pain in the area, and explain a little more about K-tape in general. But there's one thing I do want to touch on before I do move on, and that is the idea of source versus cause. And in the end, you know, we often see a lot of resources online that offer quick fixes, and you know, I get it, right? It's natural for us to want to hit those quick fixes. And all of these methods really are temporary methods of reducing pain. And treating many of the pain conditions we suffer as gamers can be quick, but it's generally more than just massaging the muscles or putting tape on them or putting a cold pack at the end of every session. These are just solutions that address the source of the pain, which, as I mentioned earlier, is the tendon. So you'll massage the tendon to allow it to relax, and that reduces pain. But it doesn't change the fact that our muscle doesn't have the endurance to tolerate 4 hours of playing, or the fact that you're playing 4 hours straight in the first place, or poor posture leading to fatigue. Those are the causes, and I want you guys to remember that. So here is the bottom line. You want to prevent the development of Falcon Thumb with minor changes, with your lifestyle, your posture, your ergonomics, and of course exercise. You want to actually perform the exercises to build up your endurance and follow the walkthrough that I'm linking and have been referencing this whole time. And you want to also manage your pain as necessary. And I think one big question is always, when is it going to go away? You know, and I wish it was an easy answer, but everyone is different. You know, it depends on how long you've been dealing with it, and it always depends on how sensitive also your pain system has become. But I can tell you that if you guys follow our 3-step process, the POP process, prevention, optimal loading, and pain management consistently, and pay attention to the recovery principles in general, you can really expect significant improvement in your symptoms within 2 to 3 weeks. Your tendons will get stronger, your nervous system will adapt so the pain reduces, and eventually you will be able to play for longer periods without pain. So remember, be patient with this process. You're steadily building up your endurance meter. And I also want to make sure that you guys know when you should actually reach out to a physical therapist. And I would say, if after 2 to 3 weeks of time of doing these exercises and you don't notice any changes, I would go, because they will be doing a full assessment of basically everything, identifying everything that I had mentioned so that it's a little more specific to you. It's a little tough for me to provide really individualized interventions online to every single person, so that's why it's helpful to see someone at the clinic that will be able to identify stuff and utilize specific tools to identify these metrics that are causing or at the root of why you have Falcon Thumb in the first place. And one last thing I do want to mention is about tissue adaptations. And as I said before, it does take time for your tissues to adapt, and generally the accepted timeline in the research is that it takes 6 weeks. So I say in 2 to 3 weeks you will get better, because it's expected that you'll sort of calm down your nervous system, your tissues will start adapting, it will gradually get stronger. But really 6 weeks is supposed to be the time that it will take to more or less resolve if you're really diligent about everything. And of course everyone's a little different, and some might take longer depending on how long you've been dealing with it. But I would say for most people, if this is the first time that you've been dealing with it, 6 weeks is a good sort of benchmark you can look at to see if you're making some progress, as that's how long it takes to have a change of strength or endurance if you're really consistent with everything I mentioned. So thank you guys so much for watching this series, for taking some time to learn a little more about yourselves, a little more about your bodies, to address Falcon Thumb. Please like, subscribe, please share this with anyone that you guys know that you know it'll be helpful for, and check out some of our other series that are going to be coming out soon. Adios.